Dear compatriots, now is not the time to lament. It is the time to act decisively and to act together. Our message is simple. We have to stop the spread of HIV. We must reduce the rate of new infections. Prevention is our most powerful weapon against the epidemic. All South Africans should take steps to ensure that they do not become infected, that they do not infect others, and that they know their status. Each individual must take responsibility for protection against HIV. To the youth, the future belongs to you. Be responsible and do not expose yourselves to risks. Parents and heads of households, let us be open with our children and educate them about HIV and how to prevent it. Ladies and gentlemen, we are still marking the 16 days of activism against violence on women and children. During this period, it is important that we also remember to uphold the rights of women and children, including their rights to protection from infection with HIV. Many women are unable to negotiate for protection due to unequal power relations in relationships. As we mark the International Day of Persons with Disabilities on Thursday, the 3rd of December, let us remember the impact of HIV on persons with disabilities. We have to tailor government programs and messages to also speak to the needs of this sector. Fellow South Africans, to take our response a step forward, we are launching a massive campaign to mobilize all South Africans to get tested for HIV. Every South African should know his or her HIV status. To continue to prepare for a continuous voluntary testing campaign, we should like to announce a few new measures to expand our response. All children under 1 year of age will get treatment if they test positive. Initiating treatment will therefore not be determined by the level of CD cells. This decision will contribute significantly towards the re-education and reduction of infant mortality over time. All patients with both TB and HIV will get treatment with antiretrovirals if their CD4 count is 350 or less. At present, treatment is available when the CD4 count is less than 200. TB and HIV/AIDS will now be treated under one roof. This policy change will address early reported deaths arising from undetected TB infection among those who are infected with HIV. We have taken this step particularly on learning that approximately 1% of our population has TB, and that the co-infection between TB and HIV is 73%. All parents, all pregnant HIV-positive women with CD4 count of 350 or with symptoms, regardless of the CD4 count, will have access to treatment. At present, HIV-positive pregnant women are eligible for treatment if their CD4 count is less than 200. All other pregnant women not falling into this category, but who are HIV positive, will be put on the treatment at 14 weeks of pregnancy to protect the baby. At 14 weeks of pregnancy to protect the baby. In the past, this was only started during the last term of pregnancy. In order to meet the need for testing and treatment, we will work to ensure that all the health institutions in our country are ready to receive and assist patients, and not just a few accredited IRV centers. Any citizen should be able to move into any health center and ask for counseling, testing, and even treatment if needed.